Good morning, everyone. It's 11 o'clock. We'll go ahead and get started. I want to apologize to everybody in advance. I'm having some technical difficulties, so you may not be able to see my picture, but I'm working on that. Hopefully we'll get it going at some point during this briefing, but for now, I think you can probably just see a blank screen. But I want to introduce myself. My name is Jessica Turner. I'm the Communication Specialist for the Rock County Public Health Department. This is our weekly media briefing, and I also have Nick Zupan, epidemiologist, with me, and Allison Chenard, the Community Health Education Coordinator and Vaccine Coordinator. And we will go ahead and get started with some updates and some information, and then when we're finished with that, we will turn it over to our media participants for some questions and answers. So we'll go ahead and get started with Nick with some data updates. Go ahead, Nick.
Sure, thanks, Jessica. So in terms of our COVID activity, we're up to 15,640 confirmed cases over the course of the pandemic. So this is an increase of about 250 additional new cases since last week, Wednesday. So we're seeing an ongoing increase in our COVID activity. Right now, we're averaging about 35 new cases per day over the last week. Last week when we spoke, it was around 30 or 32 new cases per day. So our averages are creeping up there. We're seeing ongoing spread of the disease in Rock County. Right now, we're at about 400 active cases in the community. And what we are seeing is shifting in terms of the demographics of new cases. So earlier in the year, we were seeing a percent of the new cases on a weekly basis kind of more prevalent in our older population. So there were about 15% of new cases each week among the 65 and older population. And most recently, in the last month or so, we've seen those percentages shift a little bit. So now we're seeing right around 5% of our new cases on a weekly basis being among those 65 and older age groups. And a higher proportion of the new cases are among the population 24 and under. So we're starting to kind of see the results of the vaccination efforts. There's a very high percent of our 65 and older population who has completed the vaccine series, and we're not seeing as many COVID cases among that group. As of today, we have had 168 deaths due to COVID. So this is an increase since last week. And most recently, there have been 14 patients in the hospital getting care for COVID-19. So we're just like the case activity, we're seeing slight increases in our hospitalized patients as well. In terms of the vaccine efforts, we now have over 63,000 Rock County residents who have received that first dose of the vaccine. So that's about 39% of the population. And in terms of those who have completed the vaccine series, we're around 46,000 Rock County residents who have completed the vaccine series, which is about 28% of our county's population. In terms of our vaccination efforts, and we're looking a little bit more into the details of how many people are vaccinated and how many people are missing their second shot. We have 2.2% of Rock County residents who've gotten that first dose who are missing their second dose. So these are individuals who have gotten their first dose and 6 weeks have passed since that first dose and they have not returned for their second dose. Nationally, the estimate for this rate is around 8%. So we're better off in Rock County than we are kind of when we compare ourselves to our national trends, but we're also currently actively working to try to reduce this rate to make sure people who are showing up for that first dose are showing back up for the second dose to make sure they're getting the full protection from the vaccine. And in terms of, excuse me, the number of COVID cases that we're seeing among fully vaccinated individuals in Wisconsin, there have been reports of about 0.03% of COVID cases occurring among individuals who are fully vaccinated. We have seen a lot fewer of these situations in Rock County where people are fully vaccinated and they're representing new cases. So I would say we're much below the state rate. We're at kind of a 0.0016% of our COVID-19 cases have been among vaccinated individuals. So just again, a little bit more detail about the vaccine and the COVID spread among those vaccinated individuals. With that, I don't have any more data updates, so I'll turn it back over to you, Jessica.
Thank you, Nick. I just wanted to let you know that we have an additional panelist available for questions. His name is Seth Longcar. He's the Administrative Services Supervisor. I will go ahead and give some additional updates, and then I'll turn it over to Allison to talk about our main topic. So in addition to those data updates, the CDC and FDA have lifted the pause on the Johnson & Johnson vaccine. They determined that the adverse events were very rare and that the benefits outweigh the risks. So providers can now begin administering the J&J vaccine. They made that decision on Friday, so some providers may already be administering that vaccine again. Through that investigation that was conducted, they found that the blood clotting effect that was taking place and that prompted the pause of that Johnson & Johnson vaccine was very rare. They only found 15 cases out of nearly 7 million people who were vaccinated. So we do have 3 vaccines, again, that are currently able to be administered. All 3 are very effective in preventing COVID-19, though they're not 100% effective. So there is a possibility that someone could still get COVID-19. However, the vaccines do protect you from becoming severely ill. Some mild side effects are expected when you get any vaccine, and they usually go away within a day or 2. The COVID-19 vaccines cannot give you COVID-19, and they will not give you a false positive on a COVID-19 test. We want to remind everyone that full coverage from the vaccine does not take place until 2 weeks after you receive your final dose. Additionally, there have been 3 variants that have been identified in Rock County. We have seen the P117, the B117, the P1, and the B1351 variants. Those variants have been found to be more contagious than the original strain, and a previous COVID-19 infection may not protect you from these variants. So we want to remind everyone to continue wearing a mask, social distance, and wash your hands. The vaccines have been shown to provide some protection against these variants, but if you do feel sick, remember to get tested and stay home. I am now going to turn it over to Allison for some additional information.
Thanks, Jessica. So the Rock County Public Health Department and organizations from our Rock County Vaccine Advisory Committee are partnering with Walgreens to support and offer 2 community vaccine clinics in Rock County. We want to bring the vaccine to communities that may have not yet been reached, or to provide more opportunities to have the COVID-19 vaccine right in people's own backyards and neighborhoods. We want to make sure this process is simple and easy for everyone. These clinics are open to the public, and the vaccine is no cost to you. The Moderna vaccine will be offered, and it is a 2-dose vaccine for ages 18 years of age and older. A follow-up clinic will occur 4 weeks later to administer the 2nd dose. Interpreters will also be at the clinics. So on Sunday, May 2nd, at the Beloit Head Start location, they will be hosting a vaccine clinic from 10 o'clock a.m. to 4 o'clock p.m. at their building located at 1221 Henry Avenue in Beloit. The 2nd dose clinic will be May 30th. On Saturday, May 8th, from 10 o'clock a.m. to 4 o'clock p.m., a clinic will be held at the Rock County Job Center located at 1900 Center Avenue in Janesville. The 2nd dose will be administered on June 5th. For these clinics, we have focused our outreach on the Black and African American and Hispanic and Latino populations, as well as the vulnerable populations. We want to ensure equity, and everyone who is eligible for the vaccine is welcome. If you are a person who is interested in the vaccine, you can register through links available on the rockcountyshot.com website under Where Do I Go? Then Where Are the Community Clinics? Or you can simply call 608-352-6985 6727, and you will get personal assistance, and they will walk you through the entire process to register you. Appointments are preferred, but walk-ins are welcome as long as vaccine supplies last. Also, identification and insurance is helpful, but no one will get turned away without it. If someone does not have a ride to the vaccine clinic, we offer that as well, and we can help you. Again, just call 608-352-6727. And if you have any other questions, please call that same number. We also understand that people have many questions about the vaccine. So tonight, there will be a very special vaccine educational presentation that will be held online through Zoom. This presentation will be offered in both English and Spanish. So it will be offered in English at 4:30 p.m. and Spanish at 5:15 p.m. And it is hosted by the Beloit Head Start location, and the speaker will be from the Rock County Public Health Department, a public health nurse. So if you are interested in attending that, please email covid19.questions@co.rock.wi.us and you can get the link. So please spread this message and come on down to Beloit Head Start this Sunday, starting at 10 a.m. to get your COVID-19 vaccine. Bring your friends and families too. We want to be of service to you and help in any way we can to slow the spread of COVID-19. In addition, there will also be another clinic on Thursday, May 6th from 9 a.m. to 2 p.m. at People's Church at 340 West Grand Avenue in Beloit. They will be hosting the clinic. Registration is required, so see the City of Beloit website for details. The second dose clinic will be held on June 3rd. The DHS community-based vaccine clinic in Rock County, which is located at the Black Hawk Technical College, is now accepting walk-ins. So the location is the Black Hawk Technical College at 6004 South County Road G, Janesville, Wisconsin. The times for that location at Black Hawk Technical College is Tuesdays through Saturdays, 11 o'clock to 7 p.m. Appointments can also be made visiting vaccinate.wi.gov or by calling 844-684-1064. Rides to COVID-19 vaccine appointments are now available by calling 211. So anyone who needs a ride is encouraged to call. For more information about the COVID-19 vaccine and local vaccine providers, check out rockcountyshot.com or vaccinefinder.org for information. Again, you can also call 608-352-6727. And that is the end of my updates.
Great, thank you so much, Allison. So we're now going to open it up to the media for questions. It looks like we have one media participant today. We have Austin Montgomery from the Beloit Daily News. So Austin, we are going to just give you the ability to mute and unmute yourself, and you can go ahead and ask any questions that you have. So go ahead, Austin.
All right, thank you guys. Thanks for having me. Now that we're seeing some of the clinics here be announced that walk-ins are available, are we at the point where the health department believes the vaccine supply has caught up with demand?
Yeah, I think what we're doing is we're trying to offer as much vaccine opportunity as we can in all different areas to provide the vaccine. So we are offering different community vaccine sites. We know that certain vaccine uptake is happening more in certain demographics than others. So we are just kind of focusing on what we can do to get the vaccine out to anyone that is interested in that. Nick, do you have more to share on that?
Yeah, I would say in terms of the demand for the vaccine, I think we're seeing somewhat of a slowdown in terms of the demand for the vaccine, but I still believe that there are people out there who want to be vaccinated. So as Allison's mentioning, we're trying to reduce the barriers that people are facing to get vaccinated. So offering rides, making these clinics available in these neighborhoods. It's hard to know how many more people are out there who want the vaccine and are not able to get it based on the barriers that they're facing, but we're doing our best to reduce those barriers and make sure anyone who wants to be vaccinated can be vaccinated.
And now just my next question is kind of related to the people who have missed their appointments, that 2%, even though that's lower than the national average. Is that something the health department is concerned about? And can someone reiterate just the importance of getting both shots if you are receiving the Pfizer or Moderna vaccine? Thanks.
Yeah, in terms of our rates of people not showing up for that second dose of the vaccine, that is a normal occurrence that we see in terms of any multi-dose vaccine efforts, whether it's COVID or another type of vaccine. There will be people who will choose not to show up for that second dose. We're working to make sure that people who aren't showing up are not doing it because they weren't aware of their second appointment or weren't able to get in for a second appointment. So that is work that we are undertaking at this point to make sure that we're capturing as many people and getting people vaccinated. Did I miss part of your question? I think I got the first part and I missed the second part. If you want to reiterate that.
I can take the second part.
Okay, sure.
Thanks.
Yeah, I just want to reiterate that even though the first dose of the vaccine will give you some coverage against COVID-19, you really need both doses in order to get that full coverage. So it is very important to get both of those doses.
And just lastly here, we're seeing that obviously with today's announcement, both clinics that are going to be coming up here are in Beloit. Are there issues with vaccine take-up in the Beloit area? Is that where the rates of vaccination are the lowest? Do you want to talk about just why the specific focus on Beloit in general? Thank you.
So for the two Walgreens clinics, one is at the Beloit Head Start location, and one is also at the Rock County Job Center in Janesville. So we have worked with Nick Zupan, our epidemiologist, in looking at mapping, and we have identified locations, and we feel that we want to provide more access to for individuals. So just looking at areas that had higher cumulative COVID-19 cases, higher social vulnerability indexes, and race and ethnic data by census tract, along with people who have completed their COVID-19 vaccine series. And we're also, with these clinics, we're looking at kind of like what other people are doing, what our partners are doing, offering community clinics, and just want to make sure we're hitting all different areas of the county.
And just lastly, Jessica, I think you mentioned an email for people if they want to tune in for tonight's educational presentation. I wasn't able to catch that. Would you be able to repeat that email? Thanks.
Yes, I can repeat that. If anyone wants to request the link for that educational session, they can send an email to covid19.questions@co.rock.wi.us.
Thank you. I don't have any more questions.
Great, thank you, Austin. Thank you for participating. And we want to thank everyone who's been watching us on our Facebook live stream. And a reminder that these media briefings take place every Thursday at 11 a.m. They are live streamed on Facebook, and the recordings are available on our Facebook and our YouTube channel. So we will conclude this media briefing. If any members of the media would like to participate on any future briefings, you can send an email to media.publichealth@co.rock.wi.us, and I can send you the information to participate and be able to ask questions live on these briefings. So thank you again, everybody. Be healthy, be safe, and we'll see you next week.